This is Experts on Call, and we're very happy to welcome one of our most popular experts. His impressive resume includes heading up the Faculty of Child Psychology at the University of Ottawa prior to lecturing in psychiatry at Harvard for 7 years before moving to Vancouver. Most recently, though, he's become one of the leaders in the field of biofeedback and neurotherapy, which is the medical science of adjusting brain waves. In fact, a caller to our program recently referred to him as a miracle worker, and that was a fellow doctor. Very lucky to have him in Vancouver, and answering your questions today, it's Dr. Paul Swingle, and this is It's All in Your Head. Hello, Doctor.
Hello. Good morning.
We've got a lot of information to pass along today. We're going to talk about emotional trauma, but we, of course, invite your phone call on any subject. That's any subject relating to what's in your head. But emotional trauma brings a lot of people to your clinic, and the clinic number, which I'll pass along regularly throughout the program, is 604-608-0444. Adults, children, even therapists themselves visit you for any issue relating to emotional trauma. We're even going to hear one of these testimonials that you brought in for us from a woman. It's going to be very fascinating. But let's talk about, first of all, neurotherapy and biofeedback, because I know those are big words and a lot of people still aren't sure what it is and how it works.
Neurotherapy, quite simply, is a treatment program to normalize brain function. The reason we call this program It's All in Your Head is because the symptoms we experience, sleep problems, depression, anxiety disorders, and so forth and so on, all have signatures, brain signatures. And if we can find those areas of inefficiency, then we can correct the brain inefficiency and thereby correct the symptoms. So take a very simple example, a child with ADD, which is the simplest thing in the world to fix. One form of that, the children have an excess of a particular brainwave. And when we suppress that brainwave with the child doing a self-regulation procedure, then the child's ability to pay attention and focus increases. Now, with regard to trauma, there are several critical situations in the brain. One is what enables the person to develop post-traumatic stress disorder. When I was at Harvard Medical School, I did a lot of work with combat veterans who had post-traumatic stress disorder. You can have 5 combat guys all witness exactly the same thing. 3 of them might have bad dreams, react a bit to it, feel very sad, and so forth and so on, depressed even. But only one is disabled by it. Why is that person disabled? Now, we found out that there's an area in the brain that is inefficient in terms of stress tolerance, and the individual exposed to this traumatic event, he becomes disabled because of the pre-existing brain condition. So one of the things we can do for force agencies, police agencies, and so forth is we can kind of inoculate people against these kinds of things by building up their stress tolerance by making the brain more efficient in that area. Trauma itself gives rise to a brain signature. So, for example, we're treating an ADD child. When diagnosed as ADD, the child comes in, no brain inefficiencies related to concentration, but we pick up the trauma signature. The child might be experiencing severe bullying at school that's being minimized or ignored. And of course, the child can't pay attention if they're traumatized. The treatment of that is correct the enabling condition, increase the stress tolerance, and then treat the brain signature associated with the trauma specifically. There's lots of other things that go on, which we'll be talking about. This is such a huge area. We have an enormous amount to talk about today.
Well, yeah, you just touched on one that's near and dear to a lot of people, and that's bullying and teasing. And I was quite surprised to hear you say that teasing can be incredibly debilitating for a child, and in some ways it's even worse than physical harm.
Well, there's some interesting research done by Dr. Newman at University of California. It was just published in the Journal of Educational Psych, 2005. He looked at the various forms of bullying, physical aggression, verbal threats, and so forth, and teasing. And he found that unpopular children, that teasing had the same kind of debilitating, traumatizing effect that physical aggression has in other children. Now, we may tend to minimize that, sticks and stones can break, that kind of stuff. But the fact of the matter is certain kinds of children that are in a pre-existing condition are vulnerable to that sort of thing and can be traumatized by it. And the parent may not be aware of it. The parent may just feel that the child's being overly sensitive. I mean, we've all heard this kind of stuff. Teachers saying, if Susie wasn't so sensitive, she could ignore that. but we're not paying attention to how the child's reacting. It's the child's reactions that are important and good judges of that.
We're talking with Dr. Paul Swingle from Swingle and Associates. By the way, Swingle is spelled S-W-I-N-G-L-E. DrSwingle.com is the website address, and his clinic number is 608-0444. Our subject today is emotional trauma. We're going to cover a lot of things, as you mentioned, Paul, with regards to dreams, some of the symptoms of emotional trauma. But obviously, you do bring a lot of people in because of this particular issue into your clinic. What percentage would you say? Is it a large amount of your patients are emotionally traumatized?
I would say about a third of the people that I do an initial brain evaluation on show a trauma signature. That may not be the principal reason that they're there, and the trauma may just be exacerbating the problem. So, for example, somebody who has a sleep disturbance problem, we may find that they have a general anxiety condition, but there's also a trauma signature that we can find. So we would correct the trauma issue in addition to modifying some of the issues associated with the sleep.
We'll get to some phone calls here and talk more about emotional trauma and some of the symptoms for it, some of the solutions for it, and again, a little bit more about what neurotherapy is all about. We're also going to hear a very extraordinary call that Dr. Swingle got on his machine at the clinic, Swingle and Associates, and we'll show you how dramatic the difference can be between one neurotherapy session and another. You're listening to Dr. Paul Swingle. Again, his phone number at the clinic is 604-608-0444. You're listening to Experts on Call. It's all in your head. Just heard the Weekend to End Breast Cancer promotion here on the station, and you were saying off air how there is a lot of trauma, not only physical trauma, but emotional trauma associated with breast cancer.
Yes, we see a lot of individuals with cancer. Some very interesting research associated with that. Dr. Kreutz at Ohio State University did a lot of work on women with breast cancer, and those that are traumatized by the diagnosis have poor health survival rates, what they call emotional growth rates, a year after diagnosis. So the whole issue of the enabling condition associated with the trauma is so critical in terms of how you react to these challenges and traumas. The other thing that's very interesting is work that's done on daughters of mothers who have been diagnosed with breast cancer. Very often they're traumatized. And if you think about it, of course that makes sense, but we tend very often to not be attentive to the impact of this condition on the family. One of the things we maintain in our clinic is that all disorders are family disorders, so that it's important to pay attention to how other people in the family dynamic are reacting to the trauma of a particular individual, and breast cancer is one of the best examples of that.
Thanks for waiting. Robert, you're on with Dr. Paul Swingle. It's all in your head.
Yes, good morning. Thank you. I'm a city bus driver in Vancouver, and several years ago I had a gentleman throw himself in front of my bus and used my bus to commit suicide. This was about 4 years ago now, and I suffered from post-traumatic stress disorder, and I went back to work probably about 4 months after the incident happened. Since that time, I've ended up getting really strange physical symptoms. If I have close calls, for instance, downtown, if somebody walks out on the street accidentally and I have to spike the brakes and I get a little shook up, my hands and my feet start to go numb on me. I've been dealing with this for about 3 or 4 years. I've had extensive blood work, MRIs to rule out everything else, and the only thing I can think of now is it's some kind of adrenaline blast I'm getting. I really don't know what it is, and I'm just wondering if you have any suggestions on how to get rid of this.
Yes, that's considered cluster 1 physiological responses to trauma, and it's quite common. When you have something that triggers the recollection of the event, then you get the physiological response associated with it, which is panic, fear, palpitation, sweating. All of those are implicating the vascular system, so the numbing, of course, is a direct relationship associated with that physiological response. We see a lot of folks who are experiencing these kinds of recollections and physiological responses to recollections. The treatment of that is very straightforward. First of all, you correct the neurological conditions associated with it, and then some emotional release techniques to deal with that. It's interesting. I've had 3 patients in Boston when I was at Harvard Medical School who had exactly the same trauma. One was underground driving a subway, and somebody jumped in front to commit suicide, and 2 others were bus drivers just like Robert, where people just jumped in front of a bus to commit suicide.
Robert, thanks so much for sharing your experiences, and I'll give you the clinic number again. Dr. Swingle's office at Swingle & Associates is 604-608-0444, 608-0444. Your initial assessment is very quick and simple. You attach some electrodes to both earlobes, and then you move them around the head. You get people to read. You'll do a little bit of sound therapy, and you'll just basically do, I guess, what you call a brain mapping, and you'll concentrate on the area that's affected.
That's right, and I go over it in very great detail with the person to make sure that what the brain is telling me is consistent with their personal experience.
Oftentimes, people will come into the clinic, and they'll come in for a certain reason, but they won't tell you, and you'll tell them that reason afterwards, which is what you did when I came in for my brain mapping.
I don't ask people why they come. I usually am able to tell them why they're sitting in front of me.
Let's visit with Vivek. Vivek, are you there?
Hello, Dr. Swingle.
Hello.
I had a shock on March the 30th, 2003, and around the same time, my wife had cancer of the breast. We were in the hospital around the same time. Now, what can you do for me? Sometimes I get depressed with my shock.
Yes. Now, do I understand that you had the heart attack?
No, shock. My wife had cancer. I had a shock.
Oh, okay. Yes. Okay. This is what we call vicarious traumatization, in which when a loved one is affected in some way that we become traumatized by it, which is quite understandable. Very often the person who is witnessing the trauma of some other individual themselves become traumatized. And what we do for that, incidentally, is to increase the brain's capability for self-calming, in a nutshell. The more inefficient that system, the more you respond to stress and anxiety. It's a stress tolerance issue.
You had a patient come in not so long ago, and she suffered from, and I hope I say this correctly, panic and agoraphobia.
Mm-hmm.
And I guess she left a message on your machine.
Yes, this goes back a few years. This was an individual who came in with trauma and had agoraphobia, which is one of the reactions to trauma, in which a person becomes so fearful they can't leave their house, or at least they become severely anxious when they do so. She came in, and I usually joke with my clients, and I told her after the treatment she's going to feel like Superwoman jumping over buildings in a single bound. So the first reference you'll hear is that she wasn't able to jump over buildings. This is how she responded after the first treatment.
Hi, Dr. Stewart. I didn't leap any high buildings, but I did leap some short ones, and I just wanted to tell you thank you very much. It's 10 o'clock the next day, and I'm still feeling something I've never felt in my life, which is a complete lack of fear. I was able to walk almost all the way down the hill yesterday. I'm looking forward to seeing you tomorrow, and I'm feeling more encouraged and more hopeful than I have in a long time. So I just wanted to thank you, and I look forward to seeing you tomorrow. Thanks.
Great stuff. A lot of your patients have the exact same situation happen to them. And it really varies, I guess, from patient to patient, how many treatments it takes and, how aggressive your treatments are.
Yes, there's a huge variability here depending upon what are the enabling conditions, what is the condition of the brain before the trauma, what's the nature of the trauma, how long did it go on, how long has the person been living with it, have they developed any compensatory, compensating mechanisms for dealing with the trauma. We may have to deal with those as well.
Well, it's funny because I had a student who had the exact same issue with agoraphobia, and she medicated herself with marijuana. And so it had just exasperated the situation. She was afraid to leave her home.
Yes, that's a good example. There we have marijuana addiction to deal with, not confronting the fear and the agoraphobia. So we've got a number of things to deal with.
We're going to talk more about emotional trauma with Dr. Paul Swingle from Swingle & Associates. Again, the clinic telephone number is 604-608-0444. It's drswingle.com. That's SWILNGLE. If you want more, you could look on the website. We're talking emotional trauma with Dr. Paul Swingle, one of our most popular experts. What are some of the symptoms or causes of emotional trauma? Because there are lots of them.
There are several clusters. The first is recurrent troubling dreams, intrusive recollections of the event, feeling as the event is actually occurring. That's the flashback kind of notion. As our first caller pointed out, if you have something that reminds you of the event, then you can have a lot of the physiological and emotional reactions as though the event were occurring. And in his case, if you recall, he talked about numbing and sweating and palpitations of the heart. Those are quite common, experiencing fear and panic. The second cluster tends to occur a little later on, and this is diminished interest, senses of detachment. That's the dissociation that you hear people talk about who have been sexually abused as children or raped, for example. Inability to recall certain events is an amnesia that sets in, so it affects short-term memory. Now, one of the things that is associated with trauma is a reduction in a particular waveform, and that waveform is associated with two things, creativity and short-term memory. So I treat a lot of artists who come in and complain of loss of creativity, writer's block, staring at a blank canvas, all that sort of business. Usually what's happened there is there's been a latent trauma that's emerged. Now, the artist signature is exactly opposite of the trauma signature. One is a very strong brainwave response. That's the artist signature. The trauma is a suppression of that very waveform. So what you see in the traumatized artist is the creative waveform has been suppressed. And the way we treat it, of course, is to treat the trauma, release the brainwave, which is called the alpha wave, and the creativity returns. Sleep disturbance is very, very common in trauma, and that's one of the things that we treat. You can also have a genetic condition that gives rise to exacerbating that. Incidentally, one of the things that has been developed is an herbal vitamin mixture called Silert, S-I-L-E-R-T, and it's available at Finlandia Pharmacy that aids in enhancing dream state and a more aware form of dreaming and waking up in an alert state. There are a lot of other conditions associated with the trauma, and treating trauma is very complicated in terms of modifying brain activity, but also modifying the emotional reactions that people have. We do what's called emotional release techniques to release the emotional content, and we can facilitate that by modifying some of the brain activity.
Well, we're going to talk a little bit more about dreams and how they play into emotional trauma. I'd like to take some more calls. Let's talk to Elizabeth. Hi, Elizabeth. You're on with Dr. Paul Swingle.
Thank you. Dr. Swingle?
Yes.
I'm just wondering if you've ever worked with a Fragile X syndrome child.
Yes.
You have?
Oh, yes. For the listeners, Fragile X is the X chromosome, and it affects male children.
Right. I have a grandson, yes. He's 14.
Yes, and it kind of presents like autism, is kind of like what it looks like. And yes, we've treated a fair number of Fragile X children in terms of increasing their social awareness and increasing their cognitive functioning, which I suspect is what you're concerned about.
Yes, very much so. They're quite mentally challenged, aren't they?
Yes. And again, that varies. And I think there are other enabling conditions that kind of exacerbate the Fragile X issue.
And when you're dealing with children who have had post-traumatic stress or trauma, what is the difference between children and adults that you notice?
Well, in children, there tends to be a withdrawal, a problem with focusing at school. Then at some point, they can start to become very obstinate, defiant, and aggressive. So it depends on where in the cycle you are and whether the trauma is ongoing. If you're dealing with an ongoing trauma, that's a little different than something that has occurred previously and the child is wrestling with it, so to speak. Childhood abuse has huge implications in adult life. This is no news to anybody. Certainly the listeners are well aware of that. But some of the research that's been done, Dr. Nelson at the University of Washington, I believe it is, wrote an article in the Archives of General Psychiatry about the legacy of childhood sexual abuse, and there are just huge effects later in life. Suicide, alcohol, and addiction is very, very high in this group. Depression, general anxiety problems, and always family problems with relationships and so forth.
A good example of that would be the native residential schools on Vancouver Island. Those issues have started to resolve themselves legally, but emotionally, obviously, there's a lot of pain left behind there.
Yes. Very often we do emotional release techniques with these folks to try to help them redefine and look at the abuse in a different kind of way, more like a get on with it kind of orientation. Which reminds me, I used to be on an emergency response team when I was chairman at Ottawa. And an emergency response team is designed to minimize the probability of developing post-traumatic stress disorder after some trauma. Bank robbery is a good example of that. We've learned a lot in terms of how you deal with an individual immediately following a trauma. We used to think that we wanted to debrief the person, have them tell their tale of woe and how sad they felt and all the rest of it. Turns out that's exactly what we should not be doing. Let the person ventilate and tell their story. But when you start to guide them and do your counseling, what you want to do is say, okay, that's happened. Now where are we going? So it's a future orientation rather than a fixation on what's happened in the past that has the very beneficial therapeutic effect. I remember once I was on an emergency response to a bank robbery. This was in Ottawa. This was one of the easy ones. Went in and referred to the guy as Loopy, the inefficient bank robber, because he went in, he held a gun on everybody, and he grabbed the money, ran out, ran right in front of a car, and was knocked over, and people jumped on him. Poor old Loopy was not very efficient in getting away with the money. But see, there I had a mechanism, humor, and everybody was laughing and giggling about it, so it kind of minimized the impact of the trauma.
But the person in the car who ran the bank robber over, that's the one who would have needed the counseling, I'm assuming.
Well, it's interesting you say that. That person was in laughing with everybody else. He was a suddenly deputized police officer.
We're talking with Dr. Paul Swingle from Swingle & Associates. Clinical psychoneurophysiology is his strength. He's become known all over North America for his work with neurotherapy and biofeedback. 608-0444, 608-0444. I know Elizabeth just called, asked if you worked with the Fragile X children. Absolutely. If you have any questions about traumatic and emotional trauma, traumatic stress disorder, we're going to talk a little bit about dreams and how they play into all this. Quickly recap again what neurotherapy and biofeedback does and take more of your calls. Very happy to welcome one of our most popular experts. Just to recap his resume, it included heading up at the Faculty of Child Psychology at the University of Ottawa prior to lecturing in psychiatry at Harvard for 7 years before moving here to Vancouver. But most recently, Dr. Paul Swingle, known as one of the leaders in the field of biofeedback and neurotherapy, which is the medical science of adjusting brain waves. A caller to our show not so recently referred to him as a miracle worker, and that was a fellow doctor. Dr. Swingle, we're talking about emotional trauma for both adults and for children. And if you have a question pertaining to this particular topic or any particular topic regarding brain activity, kids who lose parents at a young age, how does that affect them down the road in terms of trauma?
There are a number of quite classic reactions to that. The first, obviously, is trauma, and we pick up the trauma signature on these kids associated with that. Then if you have a look at the situation in a little more depth, you find that there are several things. One is the child has a certain sense of feeling responsible. Why was my mother taken?
Mm-hmm.
What was it about me that gave rise to that? So there's a whole issue of, do they feel lovable? Do they feel worthy? Self-esteem and all those kinds of things. The second is attachment problems. They become inefficient in their ability to attach to another individual. And the whole development of that aspect of their emotional life is very inefficient and not well developed. So in a relationship, for example, they may be extremely vulnerable, very reticent to attach because of the terrific feeling of pain associated with the initial loss, that the closer you attach, the greater that pain is going to be should you lose that person, etc. So you have a tremendous complexity associated with what happens with this individual. That's a very good example of an individual that we see in our clinic in which the psychoneurophysiology, the psycho of that phrase, is the psychotherapy, the cognitive therapy, some of the procedures that we help the person with in terms of developing life skills, emotional feelings about themselves and so forth, in addition to looking at what it did to the brain.
We talk about neurotherapy and biofeedback quite a bit, and we're going to go and talk again about what exactly it is. But I think one of the biggest benefits, and you've mentioned this over and over again, is that once you do manage to correct the certain brain activity, is that permanent? Does it stay that way, or do they have to follow up regularly, or how does that work?
No, once it's fixed, it's fixed. There are a couple of exceptions to that. When you get to be my age, the brain starts to change a bit, and you have age-related declines in memory. The good news is even with an old fellow like myself, you can speed up the brainwaves associated with cognitive functioning. So you can keep the brain very sharp. Now, there's a situation in which we normally see a client 3 times a year for brain brightening, as it's called. Dr. Budzinski at University of Florida did a lot of the early work on brain brightening with the elderly and found that you can be very effective in terms of keeping a person sharp. So that's the exception to the once it's fixed rule.
We want to talk about dreams really quickly. How do dreams play into post-traumatic stress disorder or emotional trauma?
Dreams are extremely important. One of the things that I tell clients when they come in and they are doing work with emotional trauma is that although we can do some therapy with you, counseling with you, if you feel that you want that, because we're all registered psychologists, generally speaking, you're going to do this on your own because we're going to engage the most efficient psychotherapy on the planet. We're going to engage your dream state. In the dreams, you're going to have unusual, psychologically intriguing dreams, not necessarily disturbing. And what we do is we encourage that dream state by modifying some brain activity. Incidentally, Cylert, the medication, the herbal blend that I was talking about, has an element in there to encourage dream state. And what people will experience is that they have some peculiar kinds of dreams and they start to feel better about the psychological aspects of the trauma.
Isn't that interesting? Because after you treated me for my sleep issues, my dreams started getting very strange, but very vivid and very memorable. I noticed that right away. James has a question for you, Dr. Swingle. Let's go to the phones. Thanks for joining us, James. You're on with Dr. Paul Swingle, and this is It's All in Your Head.
Yes, hi, good morning. Dr. Swingle, just curious about early childhood emotional trauma, such as losing a parent and future effects. Is there any effect on intelligence that would be different from, say, just a distraction or lack of attention, lack of focus?
Yes. There's one particular aspect of the brain that's impacted by trauma, and that's an area of the brain that's associated with visual properties of cognitive functioning. If that's been impacted by the trauma, then you get some cognitive implications associated with that, so that there's a small region of what's measured in IQ tests that's impacted by that. That's why neuropsychologists, the people who test you, with pencil and paper tests, try to find out what areas in the brain are affected. We'll find that in terms of the pencil and paper tests, the trauma impacts particular skills. And that, James, is what you're responding to, is that particular area. Now, if you have one imbalance in the array of cognitive skills that you have, that one imbalance is going to impact some others to some extent.
Right. But certainly treatable. And the clinic office is on Melville Street near Cole Harbor, and the telephone number 608-0444. In fact, it doesn't seem like there's a lot of things you can't treat, which I think gives a lot of people hope and why you get so many phone calls on the show each and every week. 608-0444 for Swingle and Associates. And if you need more information from the websites, it's drswingle.com, and Swingle is SWINGLE. And we're talking about emotional trauma today. You did some interesting work. I know you've done some work with Vietnam veterans before, but also with the survivors of the Holocaust and the impact it had on their children.
Yes, there's a good example of traumas of family events. This was particularly true in Boston, where I had a number of patients who were the children of Holocaust survivors. There are a number of things associated with that. One of the impacts of trauma is detachment, depression. And if the parent is detached and depressed, then the child is going to react to that in a sense of feelings of not being able to develop an intimate relationship because the parent is too detached. All of the problems associated with a depressed parent. That's one side of the coin. The other side of the coin is that we find that people who have survived things like the Holocaust can be hugely protective of their children. As you can imagine, that makes perfectly good sense. The impact of that may be to create in the child a sense of vulnerability, that the world is just an unsafe place. So you have those kinds of things impacting. If they have a genetic predisposition to poor stress tolerance, and that's that one area of the brain that we've been talking about previously, then they're vulnerable to the impact of their parents' trauma.
Interesting. Let's talk a little bit more in just a moment about neurotherapy and biofeedback, exactly what happens when you go to the clinic. What do you feel? What do you sense? How long it takes and all those things, because I think it's interesting that so many people have never heard of, and I guess because I've known you for quite some time now, and I talk to people who have all these issues, and they've never heard of neurotherapy, biofeedback, any of those things. So we're going to talk about that a little bit. And also hear a call from one of your past patients who suffered from panic and agoraphobia, and a phone call that she made to the clinic after just one session. Of course, more of your phone calls are welcomed as well. You're listening to Dr. Paul Swingle's It's All in Your Head. Let's quickly go to Albert. Albert, thanks for waiting. You're on with Dr. Paul Swingle. Hello, Albert. He's not there. I think he had a question about whether you were covered under MSP, Medical Services Plan.
No, the provincial plan does not cover neurotherapy. However, extended medical plans have various levels of coverage going from very poor to superb. It is also a tax-deductible medical expense, and there are some government agencies that will support this treatment as well.
But it's interesting that medication is fully supported and in many cases covered, but this isn't, and it doesn't involve any medication. I know that's been a bone of contention for you for quite some time, but you are spreading the word slowly but surely, and it seems like a lot more people are aware of it now since we've started doing that program.
Unfortunately, as you say, the medicating problems is supported, and in the area of trauma, the one thing you don't want to do is you don't want to medicate. You may have to. I mean, the person may be so distraught that you need medication to get the person over some acute situation, but medicating it is not going to treat it. And we have individuals who need more and more and more medication and become severely disabled and highly habituated or addicted to the medication.
So let's talk very quickly again about neurotherapy and biofeedback. We know it's the science of altering brain waves, but what exactly do you do to a patient when they come in? I know that when I did my initial, there was 2 electrodes on my ears. You attached them to my head and you made me read, but there's other types of therapy too, like sound and light.
Yes, we have 3 general classes of treatment in neurotherapy. The first is neurofeedback. That's what most people probably have heard of if they search the net. Neurofeedback, we set it up so that when the brain is doing what we want it to do, you'll hear a tone or see something move on the screen, on the computer screen. And it's telling you about a brain activity you couldn't possibly feel, but you make use of that information to learn how to self-regulate that brain activity. If it's a child, we set it up so they're playing a video game with their brain. The second class of treatments are the brain drivers, and my clinic is #1 in North America in the development, the R&D, research and development of brain potentiating methodologies. Quite simply, there we measure a particular aspect of brain functioning. Based on that measurement, we stimulate with light, sound, microamperage stimulation, EMF, electromagnetic fields, and so forth, to nudge the brain into more normative functioning. The third class of treatments are home-based, things like cranial stimulators, harmonic sounds, things of that nature that we know affects the brain in a particular way. We know that because we pre-test them before we prescribe them, so we know exactly what it's going to do.
I know Finlandia has some of your CDs for people who are suffering sleep problems, along with the Silert. They might want to try one of your harmonic CDs.
Yes.
Let's go to the phones again. We have Gail on the line. Hi, Gail. You're on with Dr. Paul Swingle.
Thank you. Just wanted to ask, is there any help in these therapies for people with Parkinson's and Parkinson's-related dementia?
Yes, absolutely.
Wonderful.
There are a couple of things that we can do associated with some of the symptoms of Parkinson's and also with the dementia associated with that. There's a question of how far we can go, and that depends on the severity of the condition, how long it's been going on, and so forth. But all clients benefit to some extent. The question is how much.
Thanks for your call, Gail, and you might want to get in touch with the clinic at 604-608-0444, 608-0444 if you want to read more about Dr. Swingle, drswingle.com, that's swingle.com. And before we play your theme song to exit another week, another show, you had a call from a client of yours that suffered from panic and agoraphobia. I got that right?
Yep.
And
subsequent to a trauma.
Tell us about this particular patient.
She was severely disabled by the trauma. She was hospitalized. She couldn't leave her house, and later she couldn't leave hospital grounds. And I treated her. This is when I was at Harvard. I always joke with my clients, and I told her after this treatment, you're going to feel like Superwoman, and you're going to be jumping over buildings in a single bound. That's why she started with the statement about what buildings that she wasn't able to jump over.
Hi, Dr. Swingle. I didn't leap any high buildings, but I did leap some short ones, and I just wanted to tell you thank you very much. It's 10 o'clock the next day, and I'm still feeling something I've never felt in my life, which is a complete lack of fear. I was able to walk almost all the way down the hill yesterday. I'm looking forward to seeing you tomorrow, and I'm feeling more encouraged and more hopeful than I have in a long time. So I just wanted to thank you, and I look forward to seeing you tomorrow. Thanks.
You get a lot of phone calls like that, I'm assuming, at the clinic. And I guess one of the things is not only that you're actually fixing the problem and making it a permanent fix, but you're actually giving a lot of people hope that they can resolve issues that for some of them, I guess, have affected them for years and years and years.
One of the things that we were taught in medical and graduate school when I went to school several decades ago It's just wrong. We were taught that there's nothing you can do for autism. We were taught that ADD was a condition you had to medicate, etc. That's just wrong. We can modify a lot of things by looking for the areas of the brain that have become inefficient, either because of trauma, emotional experience, and so forth, or genetic predispositions for those states. And whether it's genetic or not, it's correctable with neurofeedback. That's the whole issue of brain plasticity that people like Bruce Lipton and Dr. Ledoux at NYU have been doing a lot of work on in terms of brain plasticity.
It seems like you really do keep up a lot with current research and advances in this particular field. It seems like it's a bit of a passion of yours almost.
Yes, it is. Absolutely.
And also children. I know that you specialize and you have a lot of children that come through the clinic. You have children, I'm assuming. Do you have any grandchildren at all?
Oh, yes. Absolutely.
Is that why? But you do seem to have a lot of passion for child-related brain issues.
You know, if you can change something like ADD for a child, I have a testimonial. I obviously don't have it with me. But what the mother of this child wrote was that this little girl was going to a new school, and we had corrected her ADD. And she went to the new school and she brought in her violin to play a solo in front of the class. And the mother said last year at this time that would have been absolutely impossible because of her self-esteem issue, you know, the ADD. You fix self-esteem, you fix everything. And to see the change in these kids' lives when you've done something like that is just unbelievable.
I guess that's what made you very successful in this field, and that's why you get a lot of new patients. And if you're interested in perhaps having your brain mapped and having Dr. Swingle resolve issues of emotional trauma or any brain-related issue, here's the telephone number, 608-0444, 608-0444. And again, the website address is drswingle.com. If you want to Google Dr. Swingle, it's Swing L-E is how you spell it. Always a pleasure to talk to you, Doctor. We'll see you in a month. Do you know what your topic is going to be this time?
Probably trauma again. We'll figure that out.